Today is Thursday, April 17, 2014. This is a video continuance of my medical murder. I have cancer and multiple meningioma tumor syndrome. I live in Elk City, Oklahoma. My name is Tamara George. I have tumors, one in each of the shoulder. I have a tumor here, one in the right side, the temporal lobe. I have a cancerous tumor in the transverse colon. I have a tumor about 6 inches long by about 2-3 inches wide on the back of my left leg. Smaller ones here and there. Great Plains Regional Hospital, Elk City, Oklahoma. Every test that they have ever done, radiological tests, they always say that there's nothing wrong. Just like when I was attacked in April of 2011, there was 4 broken bones in my left foot, but the radiologist at Elk City Hospital said that everything is perfectly normal. I had an abdominal CT scan done August 29, 2013. The cancer has destroyed a good part of my digestive, my colon. It has been wiped out the first and second inner lining of the colon, a good segment of it. There's only 3 lining altogether. You have the innermost 2, and then you have the outside. I have the colon that is torn away from the entire right side of the abdominal cavity. So it goes diagonally from lower right to upper left. And the radiological reports state that everything's perfectly fine. There's no problems. Except for they did note that there's a bit of a widening of the common bile duct. Outside of that, everything's perfectly normal. I can't get any treatment for these tumors or for the cancer as long as the radiologist keeps saying that everything's just perfectly fine. There's times when the tumors are so bad here that I don't have any choice but to seek out the hospital. I went today, and Dr. Nix refused to treat me. There's one medicine that will break this pain. Because when I get in this kind of pain, it creates so much nausea and vomiting that it doesn't matter how much nausea medicine that you give me, as long as the pain has not been brought under control. It doesn't stop. And Demerol is the one medicine that will break this pain for me. And of course, he's not going to give it to me. He gave me this one anti-nausea medicine called Zofran, and did it IV. They just gave me some fluids because I was been throwing up so much. And I immediately started having a stabbing pain in my chest where my heart is, and a flutterance to it. And of course they did EKG and told me everything looked fine, chest x-rays is fine. And he told me that he never gives Demerol. And then he comes up with the statement that the pain management contract that I signed does not allow him to prescribe me any medications. And I told him, I said, I'm not here for you to prescribe me anything. I'm here for you to treat me. I do not want any prescriptions. Well, I saw a document. I looked at the document that he wrote, the statement, and of course he did everything to make me look very, very bad. And of course there's no changes that they're going to make to it. So this is the best thing that I can do, and that I have been doing, is recording my medical murder. This is how that they're killing me. I come home about 5:30. I was up there about around 1 o'clock. And oh, the pain is a lot worse. I don't know what I'm gonna do. The tumors that are sitting in my shoulder are bringing the pain up on the other side of my neck. The parotid gland tumor goes in deep. It's here, it's come up top of my head. My eyes are just absolutely excruciating. And I don't know what I'm gonna do, except that I am just gonna have to do what they've done to me so often, and that is just suffer through it. I've tried to do something about this hospital. I've tried to get help with seeking out other doctors, but it seems like it never fails that they talk with this hospital, and that's the end of getting any help. I had 2004, my left kidney was dead, and of course the hospital, their tests showed that everything's just fine, nothing's wrong. Well, they darn near killed me. I went out of state, just when I was about to be able to have the kidney removed, they come in and cancel it. They've spoken with this hospital. So the time is about 9.5 minutes, so I'm gonna have to stop. Medical murder. Man, do they know how to make people suffer. So I'm going to stop so I can get this loaded up under 10 minutes. Take care, people.